State lawmakers and the governor still haven't reached an agreement on when to call a special session.
They keep saying they're getting closer, but we've been hearing that for weeks now. Our chief political reporter, Tom Hauser, is live at the Capitol with a closer look at one major obstacle. And Tom, that is the health care for undocumented immigrants.
Yeah, Leah, the hazy air outside the Capitol, very similar to the hazy budget situation inside the Capitol. You remember that big budget agreement we heard so much about back on May 15th? We thought would be a quick end to the regular session with a budget, or at least a quick special session. Well, it's actually resulted in what has been a prolonged budget stalemate. And we haven't heard much lately publicly about that undocumented immigrant health care issue, but it could end up being the biggest obstacle of all.
Compromises that were made on Minnesota? No.
The ink wasn't even dry on a budget deal May 15th when angry rank-and-file Democratic lawmakers banged on the door of the governor's office while the deal was being announced.
And that is something that people are going to object to.
They were angry about an agreement to phase out undocumented adult immigrants from the state's public health insurance program, Minnesota Care. So far, DFL legislative leaders are sticking with that agreement despite objecting to it.
We hate it. I mean, it's a cold-hearted, partisan, ideological stance that is not required to settle a budget. But that is the condition that's been demanded by the House GOP.
It is unaffordable.
But could it be a deal breaker?
It is not a deal breaker for Republicans and most of the state of Minnesota.
Here are the facts. As of April 24th, just beyond the first quarter, more than 20,000 undocumented immigrants are enrolled in Minnesota Care. The original estimate was 7,700 would enroll. There have been 4,300 claims at a cost of about $3.9 million. Based on nearly triple the number of anticipated enrollees, the Republicans say the cost will also triple. However, the program was projected to cost $3 million in the first 3 months. The actual cost was about $3.3 million. The Department of Human Services says so far they're sticking with a projection of a $200 million cost through 2028. And I'm told by DHS today that those numbers will be updated next week. And we should point out that 25% of those undocumented immigrants who are enrolled in Minnesota Care right now are children who will be able to stay in the program under the agreement that has been reached. Now, while the DHS projection remains at $200 million through 2028, Republicans are convinced it will soar to $600 million, and it will take some time and more data to know who might be right. Live at the state capitol, Tom Hauser, 5 Eyewitness News.